Thank you very much, everyone, for joining us tonight for the Bridge Dance Project Atlanta chapter. We're celebrating the week of International Dance Day, which is this Friday, with this educational series. The Bridge Dance Project is a grassroots network supporting the whole person health and wellness of competition and commercial dancers and teachers by providing current dance medicine and science information. Our mission is to build bridges between the competition and commercial dance community and the dance medicine and dance science community by providing easily accessible, readily applicable, and personally empowering information. If you would like to host a free workshop at your studio, please reach out to us at thebridgedanceatl@gmail.com. If you would like to start a chapter in your area, you can find information about that on thebridgedanceproject.com. We are super excited to welcome Anne MacDougall from Atlanta Dance Medicine tonight to talk about injuries. Dr. Anne MacDougall is a physical therapist and the clinic director for Atlanta Dance Medicine. Atlanta Dance Medicine is a highly specialized performing arts, physical therapy, and performance clinic with 2 locations in Roswell and Ormond Park. Atlanta Dance Medicine specializes in treating dancers, gymnasts, and performing artists, as well as non-dancer clients, and also serves as a physical therapist for the Atlanta Ballet Professional Company, and graduated with a Bachelor of Science in Biology and a minor in dance from the University of Georgia, and earned her doctorate in physical therapy at Mercer University. As a classically trained ballet dancer for 21 years, Anne has a passion for the performing arts and dance medicine with a vast understanding of dance technique, dance-related injuries, and dance-specific rehabilitation. Anne is a certified myofascial trigger point therapist through MyoPain seminars where she is certified with trigger point dry needling. Her clinical specialties include manual therapy, dry needling, myofascial release, return to sports rehabilitation, performance enhancement, and wellness injury prevention. So thank you so much, Anne. Let me go ahead and pull quite an impressive bio. Let me go ahead and pull up your presentation. And then you can just let me know when to advance the slides.
Perfect.
Okay, let me share my screen again. Bear with me.
Awesome. All right, well, thank you so much for that intro, Melissa. I'm very excited to be part of this virtual series. And on behalf of Atlanta Dance Medicine, we're very excited to be part of the Bridge Dance Project. And on the last slide, we'll kind of give all of our information and contact. That way you guys can get in touch with us as a resource. And if there's anyone that needs us or you know anyone. Today, we're going to talk about dancer injury. So help, I think I'm injured. What do I do? And we're going to discuss the difference between soreness and injury. We're going to talk about different things we can do. Who should you see? What should you have in your dance bag? And then how do we modify a couple of risk factors so that we can promote that injury prevention and overall wellness? All right, go ahead and head to slide 1. So considerations regarding dancer injury. I'm sure you've heard it before and it should seem pretty simple, but acute versus chronic injury, what's the difference? What do we often see? Acute injury is just a little less common in the dance world. It doesn't mean it doesn't happen, but it's typically going to be a result of a specific injury, falling, a twist, a roll, something like that. It's your lateral ankle sprain, fractures in the foot, ACL tear, that kind of thing. Chronic is what we're going to see a lot of, right? It's over time, microtrauma, repetitive forces, muscle imbalance, faulty mechanics, poor technique, stuff like that can kind of set us up to have and be predisposed to having certain injury. And it can be as common as a tendonitis, like Achilles tendonitis. We are looking, especially as physical therapists, to do that conservative treatment, but there is that small percentage that does have to have surgical intervention. So it's not going to be everyone, but we're just trying to, set you up that we hope that we aren't going to get to that point, but it does happen. So variables that can come into play that are risk factors. So intrinsic risk factors, things within us that are inherent, our age, our gender, our weight, anatomy, where's our nutritional status at? Where is, what's happened in our past medical history, our stress levels? Are we super hypermobile? Do we have a hypermobile syndrome, right? And then those muscle imbalances, faulty mechanics, stuff like that. Extrinsic, the things that are around us in the environment. So the type of choreography we're doing, the teaching style, the flooring, the lighting, the costumes we have to wear, the props we have to hold, environment, and then of course, footwear changes. Go ahead and head to the next slide. So where and what? Where are the most common places that we look at with injuries? We're going to see a lot of low back injuries, hips, knees, ankle, and foot. Of course, we're going to see other stuff, especially when you're doing any form of partnering or lifting mechanics. You can have that head and neck and shoulder. But the types of injuries that we see, especially some of these acute ones, can be like a sprain of a ligament or a strain of a muscle, fractures, dislocations, muscle spasms, blisters are bruised or infected in ingrown toenails, shin splints, stress fractures, and tendonitis. It's a lot of stuff that can happen. Go ahead and head to the next slide. So am I injured? Big question. What's going on? Something just happened. How do I know? So just understanding, typical muscle soreness. Muscle soreness occurs within 48 to 72 hours after increased and or intense activity, but it will subside. And you're typically going to see this as symmetrical on both sides. So if I were to go do 30 squats tonight, I'm going to feel it in my quads tomorrow, right? And it's going to be a little harder for me to localize the pain. I can't just say, oh, it's right here. It's right in the middle of my thigh. It's going to feel more diffuse down the thigh. But with typical injury symptoms, we're looking at redness in an area, swelling, warmth over that painful area, especially if we think about that lateral ankle sprain. You roll your ankle, it's blowing up like a balloon, it's red, it's tender to the touch, that kind of stuff. Feeling of instability, pain that can come on suddenly or doesn't go away after 72 hours may indicate that there's something more going on that's not just muscle soreness. Certainly difficulty bearing weight. So, some injuries are not so clear like rolling your ankle, right? But if you are suddenly having difficulty bearing weight or putting your shoe on, stuff like that, that can be something that we want to consider potentially getting checked. And then certainly pain that occurs slowly with no known cause. And if it's very, very intense, it's definitely something you want to be thinking about. Pain that's shooting or tingling or sharp in nature, that could be indicative of a nerve issue. So that may be something where you do need to have someone else be looking at that. And then also just as a general rule, typically with injuries, it's going to be asymmetrical. So, if you roll your ankle, it's not going to be hurting. If you roll it on the right side, it's not going to be hurting on your left. Okay. All right. Head to the next slide. Injury treatment. So wanted to just make note about the apprehension that dancers often have, especially in this world that we're talking about with competition and commercial dancers, of just the apprehension of seeking healthcare treatment. There's a big fear component, right? Fear of being taken out, fear of being replaced. The time off may cause losing technique in that progression, appearing weak or damaged to teachers, choreographers, other dancers, or if you have an audition that it's happening at that time. And then of course, the financial considerations and health insurance limitations. Speaking on physical therapy, depending on your coverage plan, you could have 4 visits or you could have 100. And it really, and certainly your accessibility to finding PT or being able to pay for that, that can definitely be difficult. And the other thing that we want to, put note with is that whether or not you believe or you've been told that pain is normal, right? We know how much you're pushing your body every week, every day, and pain and soreness, it's difficult to kind of differentiate between the two, but being supported by the healthcare professional that your pain is real, that something is going on. This is definitely treatable, and not just being told, or you believing like, you know what, I just have to push through this. Because we kind of get to that point at the next, where what you should be concerned with when injured, you want to rehab that ASAP. And you want to do that before it becomes a more serious injury. So if we can treat a smaller or less severe injury now with modifications and whatever that means, we may prevent the need for complete rest for a more serious injury in the future. And that's definitely the goal. Okay, go ahead and head to the next one. So where should you go? So in Georgia, many physical therapy clinics actually allow you to have treatment by a PT without a physician referral. So that's called the direct access rule. We're very happy that that happened for us. So you can have either 8 visits or 30 days, whichever one comes first. And you can actually come to me as a PT without a referral, and I can be that first line of defense for you. And if I look at you and see that this is something bigger, this actually your pain, because let's just say a fracture, a small hairline fracture in the foot, that can be difficult to find pain-wise, right? It might not be super clear. But if I'm going to be looking at all of your presentation and your pain, and I feel like, you know, this looks a little bit more than just soreness in the foot, I can refer you out to go have that X-ray or that MRI that you may need. Also, considering a healthcare provider that has experience with dance and performing artists, or has personal experience with dance and dance injuries, super important. You want to be supported by the healthcare professionals that you're surrounding yourself with, that you're seeking out, especially someone who's actually going to fully understand what you're going through, the demands, the goals you have, what it actually means in terms of your timeline. And then they can actually do that full evaluation of dance specific positioning and movement. So they're actually looking at you within your technique, right? You're showing them what hurts or what you can't do, versus not actually having someone assess your movement. It's super important that they can see and understand your body. You're going to, you know, the likelihood, very hypermobile, right? Very flexible, and just understanding the amount of joint play you need to be able to do certain technique and stuff like that. So for physical therapy, specifically in dance medicine, what we work on, we do a lot of manual hands-on work. So we're working through the muscle tissue, we're working through the fascial layer. So that's the layer in between the skin and the muscle, and addressing tissue extensibility, addressing tension, trigger points, pain in the area from muscle soreness. We will be taping if that's necessary or part of your treatment plan. Taping can be used to facilitate muscles. It can be used to, if there's something with instability going on, it can actually be used to keep a joint in place, you know, as necessary at that time, and then slowly moving off from that. We're of course going to be looking at stretching and strengthening of the muscles. Big balance here in the dance world, right? You have to be super flexible, but also extremely stable. And those are 2 different things, and that can be really tough. So we're going to be working on that, because we understand that. We understand muscle imbalances. We understand which muscles are tight and facilitated and used all the time. And we understand the ones that are weak and inhibited, and we got to get that to balance out. We are also going to utilize Pilates and yoga-based exercises. Several of our physical therapists at Atlanta Dance Medicine have certifications in Pilates and in yoga. And that way we can actually incorporate those movements to promote stability, to promote mobility at certain joints that actually will pair very nicely with your dance technique. And then of course, dance specific exercises. So actually not just saying, yep, you're going to sit down, you're going to do these squats, and then you're going to do these lunges, but actually making them applicable to your technique, or running through your movements and running through your leaps and your jumps and stuff like that. And then can't forget, because dancers are always super clumsy, my mentor always has a great joke where it's like they are amazing on stage or in competition and performances, but they bump their knee or their foot on the coffee table that's been in their living room for 10 years, right? Working on balance and proprioceptive training. So making sure that we're actually taking it a little further. We're not just doing a single leg stance and trying to do this, but actually making it work for what is going on in technique, and using certain tools that can really challenge that part of the brain and part of the body. All right, next slide. Dancer first aid. This is going to be obvious, but we just can't forget about this. So actually looking at the PRICE protocol. So protect, rest, ice, compression, and elevation, and then adding in at the end, diagnosis, right after you've done that. So protection, we're going to modify activity, whatever that means. That's going to have a range depending on the injury. We may be taping, we may be wrapping, using bandages. We may have to go even further depending on the injury of a brace, a boot, a cast, or complete non-weight bearing with crutches, right? And then rest. There's 3 different types here I want us to think about. Are we modifying our activity level? So is the pain not too bad, or is it something that we just need, like, for example, say that I did those 30 squats and my quads are on fire. When I may go to dance the next day, maybe I'm not going so deep in my plies to not continue to aggravate it. I can still dance, but I'm not going full out, right? We're just modifying, maybe marking. There's also active rest, right? So there's certain areas where you may not be able to move a certain joint, but you can move other joints. So you're still doing things to keep up cardio or keep up mobility in other regions, but we are keeping rest in the region that actually needs it. Or there is complete rest, right? And that may be post-fracture, post-surgery, where you are actually toning everything down and allowing yourself to fully go through that healing process, because that's going to be important as you continue with your injury and you rehab and with your progression. Ice versus heat. It's important to know the difference and when to use it. I get this question a lot. So when you have swelling like that lateral ankle sprain, your ankle's a balloon, you're going to elevate that leg and you're going to ice it. We're going to ice for 15 to 20 minutes max, but you can do that a couple times during the day to actually promote that swelling to come down. We need inflammation in an area to heal, but we don't want inflammation sticking around. Different with chronic injuries, right? That soreness or achiness or stiffness feeling or super tight, then we may want to use heat. You can also use ice. It's not a problem. It might be preference to you, or sometimes we're moving in from an ice bath to a hot bath and we're doing that contrast. Also, just to note, heating really means moist heat. So whether or not that's through water in the hot bath or an Epsom salt bath at the end of the night, or you are actually using a moist hot pack that you can put into a microwave or something like that. The moist heat is actually going to move into the skin, bring that blood flow to the surface. It's going to do a lot more than a heating pad would. The other thing, and apologies for my dog going crazy outside, compression. So wrapping, taping, using compression sleeves or tights or whatever, anything to decrease the swelling. A lot of times, some of my dancers may have had an ankle sprain and now we're 2 months out, but there's still that lingering swelling, and it definitely gets worse as you're trying to dance more and you're standing on that leg more. And as the day goes on, you can notice that swelling kicks up and it gets hot. Just using a compression sleeve to be able to promote that swelling goes out. And then if that's the case, or if we're post-acute ankle sprain, elevation, right? So we're elevating above the level of the heart for acute injury to decrease swelling. So it's very important that we're actually above the level, because we're allowing all of that swelling to come down and actually go out of the lymphatic drainage system and the lymph nodes. Especially when you're talking about lower leg injuries, swelling can pool down lower. So we have to get it elevated to get it out. And then lastly, see a professional, right? So you've taken care of this price protocol, you've done what you can. Injuries don't always happen at a perfect time during business hours, right? So we have to take care of what we need for the time being, and then we need to go find that physical therapist or that physician for that evaluation to make sure that there's nothing else going on, or get that imaging if needed, just in case, right? Even though you've already taken care of a good bit of it immediately after. And then dance bag essentials for first aid, just making sure you have those Band-Aids, the elastic bandages, ice packs, tape, moleskin, alcohol wipes, anything to use right at that moment, already there and ready for you, so you're not searching for that. And go ahead and go to the next slide. All right. Being aware of your own individual limitations and avoid forcing your body. This is just important for your health of your body, your mental health, just making sure that you're thinking about your body and am I pushing it too far, using your gut, right, for that injury prevention. Wearing supportive shoes outside of class, we add this one in because I'm always yelling at my dancers, like, what are you wearing? Because if you can fold that shoe in half, it's probably not the best shoe to be wearing. I know we're about to go into flip-flop season and we're not going to have a lot of arch support, but just make sure you're wearing good supportive shoes around those ankles. You guys are so flexible that you need to be taking care of your body outside of class, because that's when that's when injuries can happen. That's when you're not thinking about it. That's when you bump into the coffee table, you roll off a curb, right? Be wearing those supportive shoes, wear the appropriate clothing into and out of the studio. That's especially, important in colder temperatures. It does get cold here in Georgia, but also in between your rehearsals or in between, a dance competition, not letting your body get cold, wrapping yourself, keeping warm. Next two slides are going to be about warm up and cool down. We'll talk about that, but just the importance of actually setting a really good warm up, a really good cool down to make sure you're taking care of your body. And then self-management techniques. So along with that first aid kit, have your foam roller, your lacrosse ball, your tennis balls, your massage guns, do proper stretching, consider that. All right, next slide. Warm up. I know you guys all know what this is, but I'm just going to continue to hone in the point because it's so important. Like, why do we do this? The purpose of our warm up is to increase that body temperature, the heart rate, the blood flow. So you actually prepare that body to do what you're about to ask it to do. So including 10 to 15 big body movements, right? Whole body in different planes. Like, let's just think about, jumping jacks as an example, right? Getting that heart rate up and moving the whole body, then going into those specific movements for smaller joints. So whether or not that's TheraBand work at the ankle, or you're doing some glute work with clamshells and bridges, but thinking about the whole body and waking it up and getting it prepared. And then, can I stretch at that time? I would argue that you should maybe be foam rolling, right? We're moving through tension in the muscle and top bands. Foam roll those key muscle groups, get that kind of like the way you knead dough before you're going to bake something, get those muscle groups primed and ready, and then do that dynamic stretching. Static stretching in that moment when you're not completely warm, you are, taking risks at having micro tears in the actual muscle belly. You could be pulling on really tight tendons that are attaching into your bones. It's just better to, at this time, do that dynamic stretching first before we think about that static stretching later, okay? And then we'll head to the next one for cool down. So why do we do the cool down? Purpose is to return to baseline temperature, heart rate, blood flow. This actually can help decrease the soreness, that delayed onset muscle soreness that is coming from the lactic acid buildup. We want to try to avoid that. It's not always avoidable, but doing the cool down and really bringing everything down in a slow decline and not just stopping when you're huffing and puffing and running out the door, but taking that extra, 10 to 15 up to 30 minutes of just cooling down. This is a great time to pull in those yoga exercises where you're working on cat-cow and thread the needle for thoracic extension and flexion and rotation, moving through your joints. They're warm, they're lubricated, they are going to give you further stretch. You're going to feel more open, working into child's pose for the hips, moving it side to side, and then even taking this into deep diaphragmatic breathing. So laying on your back, having your knees up, holding your belly, and working on some deep belly breathing, all right? Bringing everything down. And then, can I stretch here? 100%. This is a great time to be working on those splits to get a little further. The body is warm. It's going to promote that tissue extensibility. In order to, you can hold it for 10 to 60 seconds. A lot of times I tell my dancers, you want to get to 1.5 to 2 minutes of stretch. And I usually break it up by saying like 4 bouts of 30 seconds, but that will actually make tissue change. But this is the healthy time to do that. This is the best time to go in and try that. Okay. Go ahead and head to the next slide. All right, so modifying your risk factors. We're going to have more about this week, but nutrition, fueling your body from all food groups, consuming those adequate levels of vitamins, your calcium, your vitamin D, your B6, B12, and your iron, making sure you're hydrated before, during, after dance. The goal is half of your body weight in ounces per day. I use one of those water bottles. I'm not dancing and I'm in the clinic, that has the time on it, right? And just making sure that I'm staying with that and getting through 2 of those a day as a reminder. And sleep is huge. You want to minimize the distractions and the stimulation from technology as you're winding down, like put away TikTok and Instagram, maybe do some mindfulness and meditation, and let that be what kind of takes you into sleep. The average teenager needs 9 to 9.5 hours of sleep per night. Is there anyone here that's getting that? I know that I'm not, but that's because of my 11-month-old baby. But super important. All of this is modifiable, and it's huge within your health and how your body's going to respond. Okay. All right, head to the next slide. And then minimizing stress. So being mindful of those high stress periods, exams, holidays, auditions, all of that. Practicing that mindfulness and meditation in whatever ways that works for you. Seek out mental health counseling. We are a great resource. We have great people we can refer to, but just considering the pandemic and its effect on the performing arts world, it has been tough. So you want to make sure that you are addressing that component, that emotional component, because that limbic system has an absolute effect and a big relation to our musculoskeletal system and how we are as a person and how we perceive stress and anxiety and how that manifests in our body. And then big plug for cross training, right? Training outside of what you're doing, Pilates, gyrotonics, strength training, cardio for sure, especially dancing in these masks if you still are or were. And then swimming, yoga, and different styles of dance, super important. And then last, seeking treatment. So as soon as possible to address that small injury so we can prevent the larger problem. You've got great resources. We are a great resource. We have lots of people we can refer to, lots of MDs. You can come see us, and just making sure that you're putting yourself first and your body first before allowing something bigger to happen. All right, and then our last slide. Big thank you. Thank you guys for having us and being part of this virtual series. We are, like Melissa said, in Roswell inside the Tolbert UMass School of Dance. It's a beautiful facility. We also opened our second location in January in Ormwood Park inside the Neighborhood Ballet, a beautiful historic building. So you can find our website, our Facebook, our Instagram, and then I have our admin email and my emails as well. I will see both, but if you want to email me personally, please contact, let us know, let us be your resource. It's been great being able to talk to you guys about this tonight.
Awesome. Thank you so much, Anne. That was so much information. Does anybody have any questions that they would like to ask Anne? We have just a few minutes. And I have one, actually. I was a dance coach for 10 years. And so it's very hard to distinguish between when to push because it was hard for me to be like, I don't know your body. I don't know what it feels like. And it was hard for them to be like, well, I think I'm injured, but maybe I'm sore. Like, what advice would you have for a coach that's like, I don't know when to push and we're about to get into competition season and I don't know, like, where's the line?
Oh, the line, there is no line. It's so great. I feel like, I mean, I have the same thing. I have a lot of competition dancers right now as well. And it's, full blown competition season. We've been in it. It's really tough. It's really tough to understand. I think, going back to that, those symptom pages, like if there's those symptoms that I wrote down in the bullets, if there's specific words that are coming out that you feel like it's burning, it's tingling, or, those may be better factors, but when it's really gray, that's where we come in, are a great resource for you guys. You know what? Like, I can't tell right now. And that practice didn't go as well as I thought with her. I'm just going to see if she's open to going to see someone, because we're not in the business of taking anyone out. We want to keep you in it. Right. And it may be that, there are, not to get into the nitty gritty, but there are certain, trigger points in the body that can be in the glute that can feel so much bigger and worse because it's so deep and it's got this referred pain that feels like it's a bigger injury than it is. And then there's times where it is that injury and it's sort of like under the surface and you don't realize. And because we have that notion too, that we have to push through pain as dancers, right? It's part of it. But I think there's that gut feeling, maybe there's an emotional response that you're seeing from that dancer. Just never hesitate to go, you know what, like, maybe we should just go see someone. Maybe you could talk about it more. Maybe you do get that x-ray to see, maybe you go see the physical therapist and she works through, tests your strength, looks at your joints. I wish it was clear. That's why it's so important to have the injury prevention lecture and talk about this, because we just don't want to see anyone being missed and then having something really big happen. But it is really tough. It's tough to, it's tough to find out. I have a couple dancers where I'm like, even I have to go, you got to tell me what that felt like today, because like, and I usually use a pain scale, right?
Yeah.
Don't let it get over a certain point, because that's where we're in a no region. But if we're here and you're feeling okay, that's where we're going to stay. But some injuries are just, in the injury process, can be really complex. And there's other factors that are part of that. Those modifiable factors we talked about: stress levels, nutrition levels, sleep, school, personal issues,
Yeah.
all that kind of stuff. So, yeah.
That is great. If you, and it is just now time. So if you have any other questions, make sure that you reach out to Anne. I will go ahead and put her contact information back up. There we go. Perfect. So if you have any more questions, please feel free to reach out to her. And if you are in the Atlanta area, Atlanta Dance Medicine is a phenomenal resource for you for physical therapy and for all of these other referrals. And then, of course, if you are not in the Atlanta area, the Bridge Dance Project, you can look at all the networks and they would be able to connect you with somebody in your area. So I would like to thank everybody, and thank you again, Anne, for presenting tonight.
Thank you so much for having me.
Absolutely. And we hope to see everybody tomorrow for our nutrition talk.
Perfect.
Thank you so much. Have a great night, y'all.